So if anyone has any questions, please.
Hello.
Yes?
You had mentioned one book that obviously inspired you. Are there other books or other things that you've read? Or?
Oh, yeah, actually, probably the best book. I liked Malcolm Gladwell's point on that, but a lot of it was I Opine, which no data. The plural of anecdote is anecdotes, not data, not science. The author I like most for kind of psychological principles is called Dan Ariely. And he wrote Predictably Irrational. He wrote several other books, but his first one is Predictably Irrational. And he's an experimental behavioral psychologist. He was at MIT, is at Duke now. He's also a very entertaining speaker and just a generally funny guy. But he does experiments to explain why we do things that don't seem to make any sense. And much of our economic and social models are based on the fact that we're rational beings, but we're not. It's a thin veneer of rational on top of lots of tumultuous emotions. And he sort of figures out the pattern. One or two of my favorite examples. If you have a 6-pack of Coke that you bought for yourself and you put it in the refrigerator at work, is it going to even last a day? It's going to be gone. But if you had six $1 bills and you put them on a plate and put them in the refrigerator, most places they will be there for months. Well, why? It's the same value. In a society such as ours, where food is essentially worthless, we don't see taking the Coke as stealing. It's, Bill will never miss that, and people take it without thinking of it. But if you take a dollar bill, you're a thief. And we don't want to view ourselves, most of us, as thieves. It's as Aristotle said, no man wants to appear evil in his own eyes, or Kant, no man wants to appear worthless in his own eyes. The last several thousand years of history is based on that you really, it's how you see yourself. And so we will often not see ourselves as doing something that's not our best behavior because we rationalize it. The other is we are very careful to separate in our own heads a monetized and a non-monetized relationship. So if a friend of yours calls and says, I'm moving tomorrow, and it would be really great if you could help me. I really need you to spend the day helping me move. That's a good friend. You're probably going to say sure. If that same friend were to call you and say, I'm moving tomorrow, and I really need your help. I'll give you $10 if you'll help me. You're going to say, no, I don't want to spend hours lifting, carrying for $10. Forget it. And the difference was, one is in the name of friendship. You're going to help your friend. The other, as soon as they've made it a monetary transaction, you're calculating, is this worth it? No, it is not. So you want to be aware of those and not mix them and not confuse them, in a business environment. Business has to stay business about money, about what makes sense, and relationships are a different category. Yes?
Could you give an example of maybe one time where you're stumped in a diagnosis and how you might come to terms with that, or step back, or get a new view, and how or if that kind of thinking has affected your leadership? As I wonder how your practice and your craft has led to you being a certain type of leader, or a medical leader might be different than a financial leader based on some experience in the field.
Okay, I think my leadership in the hospitals is two different things. I have more credibility because of my skill as a physician, but the leadership actually has more to do with these 5 categories being applied in meetings, and as Mary said, 1 hour. Actually, before I was chief of staff, nobody showed up to any of the meetings because they rambled on for hours, and I put in a rule of, we will be here for 1 hour. We will start on time, we will finish on time, it is 1 hour. And we started having 90% attendance. And also, of course, a couple weeks before, any major issue would be disseminated. This is what we're going to talk about. Think about it so we can be concise. and be done in 1 hour, because we've got 1 hour. And in those same meetings, you often have people who want to hijack the meeting for some, I can't think of any kind word, for their personal agenda. And you as the leader are supposed to try to cap this respectfully. What I found in the medical world, again, where science is at least given nodding respect, the buffoons often don't want to have any examination. So what I would always come up with is say, that is a great point. That is a really interesting point. What I need is some data. So if you could come back next month with 3 articles supporting your stand and email them up to me, and I'll disseminate them to everyone beforehand so we can discuss this fairly. They never come back. They never have that. So, the puzzling cases are more, again, just going logically through. And of course, every day what I'm seeing is, I'm consulted on the puzzling cases. Infectious disease, less than half of what I see is infection. Okay? Yes.
I have questions. Both of you mentioned about having concise meetings, which I think is awesome. What if you're the attendee at a meeting and the person running it is sort of all over the place? Is there a way you as an attendee can sort of help make it concise or whatever?
No. Yeah, unfortunately, all you can do is kind of make a couple mental notes. One, I'm never coming back to this meeting. 2, I'm never doing it myself. And 3, I need to be the leader of this meeting because we're getting nothing done this way.
It's your employer. Oops. That's
Yeah. Then you're stuck. But it really, please.
One thing you might do is to offer to do an agenda. Just I'll be glad to work it up and do some timelines. Do you think, would that be helpful?
Yeah.
Just to say to this person, would that be helpful?
Yeah.
Maybe that would get it a little more on track.
Actually, with that, this is actually credit to my wife, Muffy, who has told me to do this, and it's worked wonderfully, is the agenda is, I always have an agenda that I put up for the meeting, and after a meeting, a discussion, anything of importance, I do a 1-page summary of what we discussed and have agreed upon and email it to everyone so that we have the template, and then the next time at the next meeting you can go back to, well, we decided on this, so we don't need to go over that again. Let's proceed more. And if you have the agenda or have it, you can email it to everyone again. I think we already decided that, so how about this? So you can lead from a little bit, but backseat driving is never well received by the government. Yes.
I was reflecting on what you were saying, and it struck me that very often you're in a situation where what you're doing, whatever it is you're doing that is valuable, has little to do with that area of knowledge that was the core of your education, and more to do with understanding personality, human interaction, the kinds of priorities that people bring with them, and all this kind of human melange of stuff that goes together. And part of my reflection was that's been exactly my experience as well. I don't mean that my education as a designer was worthless. Far from it. In the same way your education as a doctor was not worthless. But you think about how much doctoring did I do today, and how much did I really deal with just the interactions of people?
True, but it's the science that enables me to know the difference.
Yeah.
If someone comes, and what I see is, again, this young woman had $25,000 of testing, lots of exposure to radiation,
Right.
lots of pain, and pills that made no sense because no one was applying science and said, this is not physiologic, this makes zero sense,
Right.
It's got to be something else. On the other hand, I see people who are desperately ill and need to figure out the right drug, the right diagnosis, and get them on it. So it's having the skills, and the same thing would be in graphic design, the skills to know how to design it, but you do have to talk with the client, the patient, the customer, and understand what they're asking and what they need. It's always blending both together, and you as the professional is the one who's got to listen to what they're saying, because they may not fully understand what they're saying, and then apply your skills. But we're always constantly learning, and the skills you have are constantly changing. When you started out, probably computers were not dominant for graphic design. So you have to keep studying and learning because things keep changing. So you have to constantly improve your science.